first lecture is involved for the outline, right? So if you know the software of the computer that you do, how many hours, how long for this? 3 credit or 6 credit? You have like a lecture and laboratory, something like that. For this, the top, for this, it's mean like that, okay, for the competency, you learn the knowledge, after that, you practice. It's something like that, okay? So the objective, you can explain the process of taking patients' medical and dental history, examine the oral cavity, assessing the physical characteristics. After that, record the examination finding in the department record of the child and provide accurate diagnosis. Describe treatment planning for patient using complete data, considering their need and abilities to use data, and you can provide treatment prognosis. What is prognosis? You know the prognosis, right? What does this mean? The prognosis. Number 24. Who is the 24? Okay. What is the prognosis? Okay, we should talk later. The prognosis means that you know it's good, it's favorable, it's unfavorable, something like that. It means that you can provide treatment prognosis about this case. Okay, confidential, what does this mean? Confidential is mean like the dental practices that replace all the national dentitions. Have you seen dental before, right? In the meaning of the confidential, in the imaging, you can imagine that what that is. But confidential stay on the mucosa, right? Because don't have anything. It's just the basic of the confidential. Another thing in the future you can know about like implant or something like that. That for retained denture, something like okay. We start from the basic first for the complete denture. Okay, look like this. This is a complete denture. Okay, this is a denture. This is a lower arch. This is a lower denture. Okay. Surface of complete denture. Opposite surface is made like this. Polish surface, this is the polish surface. Tissue surface is being this tissue surface. We don't polish it. It's mean that when you do like the step by step and you finish for the denture finishing, this surface we don't polish. Why? Because it needs to capture all the foundation of the mucosa membrane, right? And this one is polish surface. Okay, this called the denture base. This all called the denture teeth. The teeth is called the denture teeth. Complete denture have is mean okay, the basic, the principle like the adequate support. Support, retention, stability, trigger. Do you know? It made the complete denture success for the treatment plan. Okay. So adequate support, stem bearing area. Remember this word, bearing area. What that is mean? The next lecture you will know what kind of bearing area, what kind of the primary, secondary bearing area. Okay, it's for the support. Retention. You know, when the complete denture insert in the patient mouth, it needs to have the right of retention. Muscle force, when the patient moves muscle, or the physical force can maybe to the denture, it will make the denture move if denture doesn't have the retention. And stability. Stability means okay, it's stable. Okay, this may be the kind of it. Okay, this is the word that you need to know, like the neutral zone. Neutral zone is the potential space between lip and cheeks, on side and tongues. And although while the natural or the artificial teeth are subject to equal and opposite force from the surrounding muscle, it means that when you set the danger should be in the neutral zone. If you make it like let's say like the lower danger, you make it forward too much, then you put it something like that. And this is why we try to set the teeth in the neutral zone, even like the extension. Okay, don't worry about it. You know when you set the teeth, you show after the declaration. Okay, so the post-operative treatment for the irregular and nearly irregular patient, we do the patient exam, patient record, and diagnosis, and all the things that you have the patient record. You know the situation. After that, okay, you do the treatment planning, and you can provide any prognosis. It's be good, be not good, but that improvement in the future, and it's been that the process will be success, the complication, know the risk of that. Patient examination of the patient, extraoral examination, intraoral examination, radiographic examination, and examination of the cat. You know the study cat, right? You do a lot of mounting. You know how to mount on the articulator, right? You set it, right? Okay. And when you set on the you mount the cat, you will know the region between maxilla and mandible. And how can we know the region between maxilla and mandible? We had a process to record, right? That is why we learn how we get it. Okay. Even right now, you are the digital generation. You know the what like the virtual articulator. Have you ever heard that? You know articulator, right? We have the virtual too. In the future, you will learn what it is. Okay, examination of the patients, not exam of the mouth. It's been like the whole things. You have to do like everything like the holistic thing. You have to know. Not just only the mouth. You have to do the examination, even like another thing that involved for the treatment plan. You have to know another thing for how about the patient attitude for the dentist, attitude about the old danger, something like that. Examination of patients, observation of the patient as the whole, even like the referral rate. It means some patient refer to our clinic. You have to know the decision, even like are there any systemic disease, are there any dark medication that they take? I think you need to. Some doctor refer to do this, to do this. Okay, this is the information that we keep it for planning. General health, medical and dental history, and mental health is very important that we need to know. Socio-economic status, dental expectation, and lifestyle. That's like if you had a patient that they have the profession for like teaching, speaking, or singing, you have to plan for them, right? Even you have like a man and woman, it may be different attitude for the dental too. Like maybe the lady concerned about aesthetic too, something like that. You have to check for that too. That is all the things that you have to evaluate for the expectation of the patient for the danger. Medical and dental history, mental health, general health, systemic disease, and dry mouth. You know the dry mouth when aging people, there are some problem about the salary fold that is like the aging problem. So that okay, it's maybe the concern that we have to check for the situation too. And paradental and denture experience is very important that you have to gain from the interview of the patient and check mental status. Okay, this is the category from the MMR mental fatigue. MMR classification like the type of the personality form. Personality. First is physio-physical type, exacting type, historical type, indifferent type. Okay. Physio-physical type, the person that okay maybe like the easygoing, everything like the spice bar, no problem. Mentally well adjusted, that's cooperative, confident in the dentist. They believe in your treatment, so they really cooperate. This type of the patient is very good. The prognosis is excellent for this patient type. The second type, exacting type, they very precise, above average in intelligence, often dissatisfied with the part treatment. They may be complain the old dentist, they may complain the old doctor, they complain everything, but doubt the ability of the practitioner too sometimes. So this kind of the patient, you need to more explain, you need to prepare, you need to more manage for this patient. So the type of the patient may be once satisfied, he may be become the practitioner greatest supporter. That is why okay, you need to support this patient. We cannot choose patient just leave the physiological type, you know. In the reality, you will face every kind of patient. And if you are the dentist, you have to face all the problem. No problem at all that you face any kind of the patient, but you have know how to manage the patient from the knowledge that you have. This is very important. Because when you graduate and you are the dentist, you cannot say, okay, this type I do. You cannot show the side that okay, acceptably this type of the patient. Okay. It means that you need to manage all the patient that we know the situation. Okay, the third is the historical type, negative attitude, often in poor health, poorly adjusted, that often appears thing but with unfounded complaint. Sometimes we don't know what it is. Fail at the part and tend to wear the danger and realistic expectation. So this type of the patient okay, hard to handle too. The prognosis is poor. It's maybe sometimes need to handle as suitable as we can too. Okay, so this case is maybe sometimes we have to teach something before. In different type, patients are not concerned with appearance, often go without denture for a year, or decide to wear the denture, do not value the effort or skill from the dentist. So this type of the patient, sometimes they don't want to wear any denture. So this is the four kind of the MNL classification. And I think we have another definition we will learn later. Okay, just only know four types of the MNL classification first. Okay, extraoral examination. Face, you know, right? The face is square, taper, oval. It's maybe the shape of the face. TMJ, basically, also lips. These are the things that you check for the extraoral examination. Intraoral examination. Anatomical structure of edentulous jaws, maxilla, and mandible. Okay, you see here. If the patient they don't have any teeth, remaining teeth no more, have the edentulous like this, you will see what you learn anatomy already, right? Second year, learn a lot of things in anatomy, right? Okay, you good on that? Yeah. And believe because you partied all. Okay, and you see later when we see this later, macroscopic, microscopic. Macroscopic, you see, oh, you see the graph pink something like that. Microscopic, then you cut, you know, right? The support is like the tissue, mucosa, connective tissue. How different between skin and mucosa? Mucosa is very delicate, right? Okay. The support is maybe not much too. It's very thin. That is why when we design for the denture, like for the bearing area, that is have to consider. The technique for the impression is very important too. That is why we learn step by step. Okay. So for the intraoral examination, you have to check everything. See about how long, how high for the frenum attachment, how many excess does it, how about the thorax? You know thorax, right? What is the thorax? Okay, see the picture. Okay, maxilla anatomical landmark, labial frenum, labial vestibule, looking, buccal frenum, buccal vestibule, tuberosity, median palatine suture, fovea palatini, incisive papilla, thorax platina. Some patients have a big thorax at the top. And this is all anatomical that okay, we use it for the landmark for do another step and like the location that okay we can paint or display. Okay, this is like the buccal frenum, this is the labial frenum. Is it too high? We have to thinking about that little. Too high, we need to phenectomy or not something like that. This is the labial frenum. If you visualize not effort for the retention or stability, we can keep it for that. Because before we plan to do something, we have to think about the consequence of it too. This is the buccal frenum, this is looking. Okay, incisive papilla here, used as a landmark for calling placement of artificial central incisor. Leave the upper complete denture to avoid pressure on the incisive nerve. This causes burning sensation. Sometimes okay, we need to leave. And the technique when take the vision why we leave something like that. Okay, thinking about that. And the next lecture you will know about that. Median palatine suture is here. The median palatine suture, the suture that join the two palatine process at the midline, cover with thin, dense mucopolysaccharides strips with little or no mucosa. Improper relief of it may cause instability of the upper denture. Okay, this is like big thorax. Okay, tuberosity here. We have to check for that too because the ground prominent behind the slightly above the distal end of the maxillary pelvis. It must include in the impression. It covers of more area. Okay, if you take the impression, if you cannot get the part, you need to read that again. Because we need that one for the first impression, primary impression. We have to cover these two. If this one is too big, sometimes it's like the with no space, or we can do like the surgical correction, like the tuberosis, this and that. Okay, humeral notch here. Okay. Okay, depression distal to the maxillary tuberosity used as a landmark for correct extension of the upper complete denture. Okay, this is a landmark. You know this landmark, and after that, okay, you do the step in the next when you decide for the individual treatment. That fovea palatini is here. It's opening of the ducts of the minor salivary gland. Landmark for the posterior border extension of the upper complete denture. Okay, this is a vibrating line. Okay, this is the definition. Okay, the imaginary lines across the posterior parts of the palate, marking the division between the movable and the immovable tissue of the soft part. This can be identified when the movable tissue are moving. Okay, when you say R, if you like, is move R. That is why we try to find this position. Okay, it's called the vibrating line. So you know where is the posterior border of the danger. Okay, establishment of posterior parietal seal post-stem. Okay, vibrating line, posterior border of upper danger base, the area of tissue displacement that assists with ball bonitus is the anterior border of the post-stem. You remember this? Okay, this is a ball bonitus. You know this instrument or not yet, right? Never seen it before. Okay, you just start. Okay, because it is maybe the second day of the opening semester, right? Just today it's too much or not? Yesterday you learned a lot, right? Lecture all day long. Okay, the fact is still fresh in the morning. If you try in the evening, right? Okay, don't worry. Is it the student life? Okay, when you learn something like that. Okay. Okay, this instrument you know when you learn operative something like that. Okay, that is called like a furniture. That is like the instrument that can be used it for check for how much we can displace the tissue, and we know about it that. Okay, this one just remember the post-stem, what is the post-stem, and we will learn later from another lecture. Okay. Posterior parietal seal, maybe the one that you need to remember. Okay. We try to find the posterior parietal seal. Well, the posterior parietal seal is here, like the post-stem here. Okay, this is like the cross section, and you see like in this area have a glandular tissue that is we can place a little bit here. So we record and we mark for the purpose to do the post-stem. This is the area. Okay. Establishment of the posterior parietal seal is called a vibrating line on the soft palate, usually slightly anterior to the fovea palatini. Remember the previous slide that showed the fovea. Check like the patient say R is moved. You can see movable, immovable. Mark with the indelible pencil. What is the indelible pencil? You don't know it yet right now. Okay, don't worry. When you go to the clinic and you ask for this pencil, it's like a copy pencil, but it's used for the intraoral. We cannot use another kind of copy, right? You know the copy pencil, right? Copy pencil when you use for when you learn the art, when you are in high school, that's another kind, different. Okay, so it's called an indelible pencil. It's like a mark. We can use that for marking. How we can use it? Okay, we learn when we learn for the trial and error, and we know how to transfer that. Okay, state bearing area. Okay, remember it for state bearing area. Like the outright is the primary state bearing area, and looking is the second state bearing area. Okay, this one. When you learn next lecture, you will know what is the primary, what is the secondary, then we have to decide. Okay, for the mandible, anatomical landmark like the labial freedom, labial vertical, buccal freedom, buccal vestibule, mylohyoid muscle, forearm mouth, and lingual freedom here, and thorus mandibularis. Okay, we see that. This is the alveolar tongue and genial tubercle. In your best when you learn for the bone, right, for the mandible, this have like the genial tubercle. It maybe is like the alveolar resolve tumor. Still it have this landmark like the exposed. You check for that what is the invade for the danger or not too. This is the landmark. Okay, retromolar pad here, maxillary muscle here, mylohyoid. This is a buccal shell. This is a buccal vestibule. Buccal shell is the primary state bearing area between high of the wrist and external of the limb. Here, the of the limb. So distal end of the lower denture should be placed two-thirds of the little molar pad here. This is the little molar pad is made landmark for the posterior distal end of the lower denture. Okay. This is the indelible pencil. So that is the blue, the violet color. Okay. My low high ornament here, located at the inner surface of the mandible, the place for attachment of the muscle of the fall of the mouth. Okay, this is the mandible, and okay, when you take the vision, you see, okay, the buccal shell, this is a low high ornament. Okay, little mylo high area provide the dental region and stability. This is a little landmark for the posterior border attention to the lower computed here. Okay, when you make the impression, you take the impression. If you start with the alginate, sometimes it cannot extend to this. That is why we try to extend more that we can. After that, we do the individual, we mold and we get on this detail. Okay, you will learn maybe 2-3 next lecture. Okay, this show that it's down here, this is a buckle here, okay, this is the extension that, okay, we try to extend. But if not, it can stable here, it have a region here, but okay, it depends. Maybe like the place that we can this place extend. Okay, aesthetic danger, anterior posterior teeth, aesthetic phonetic, retention, stability, attention, contour, integration and vertical dimension of the ocean, and also plane of the orientation. Like this, you have to see, okay, because this case have the remaining teeth that is maybe sometimes involved for the also plane, involved for the aesthetic too. When you do the curvature, sometimes we can make the right position for the aesthetic reason too. Okay, that is all the thing that you have to check too, because if this old danger in this position, if it you know this word, right? Vertical dimension of operation. Sometimes when the patient use the orator is have to wear or something like that, is maybe not the correct OBD. We have to verify the right OBD for that too. For the aesthetic nature, okay, we can find all the information from the orator too. Okay, radiographic examination, this is probably applicable if you find something that the teeth is not good, appropriate for to be kept for the treatment, need to be extracted. Okay, you can for that too. And for the panoramics OPG, okay, you can find there are some like the remaining teeth or not too. That is okay. We find for that. Study cat. Okay, alginate impression is the primary impression for the maxilla mandible in the interlaced stop tail. Interlaced stop tail is different for the tray that you make it for the patient. It's okay, look like the interlaced. Okay, when we make the primary impression of the interlaced tray, we ask for the interlaced stop tray first. Okay, when you take the impression, okay, you can get all the study care and you can plan for the individual tray for the next step. Okay. Okay, for the diagnosis, okay, definition and evaluation. Definition is mean that okay, an evaluation of existing conditions and identifying the problems. This is for the diagnostic criteria. You have to find the bone height, residual morphology, okay, phenol and muscle attachment, maxillo-mandibular relationship. You have to find which is the right position between maxilla. Right now, okay, you have the teeth, right? When you bite, it's maybe like an MIP, that is position, right? When you bite, MIP and CR is the same position. Dentation and pigmentation. far. Treatment planning, definition and process of matching treatment option with the patient's specific needs, their appreciation for electricity and ability to accept proportional treatment, as determined by careful diagnosis, a problem-solving process. Okay, interpreting diagnosis, finding to the treatment plan. Okay, evidence-based treatment procedure, that accurate diagnosis, differentiations of the treatment procedure to specific diagnosis. Outcome assessment is called a prognosis. Is that okay? Something mean like that. Okay. Okay. Through the examination and accurately recording will allow dentists to be able to come up with an appropriate treatment for an individual patients. Okay, charting and record. Okay, this is the chart record we use in the clinic. Okay, you see, it's maybe the guideline for you to check for all the information for your patient. Even you find something, you write it down. You know the pre-medication, you ask the patient. How about the medical history? How about the dental history? Okay, how about the chief complaint? It's very important because you have to know what is the chief complaint of the patient too, and you do like the extra-oral examination and all the records you record from this. You use it in the clinic for the patient record. And you do the analysis for data, and problem synopsis. Okay, and this PDR classification is the classification for the confidential from the academic of the postgraduates from the US. Okay, but you use this one. You have to know like the complete intuition, like the cut 1, cut 2, cut 3, okay, you will learn later. Okay, inter-aspect here, like the class 1 ideal. You see the ideal. For the class 2 excessive inter-aspect, okay, have more space for set up the teeth, no problem. But the class 3 have the problem like the insufficient inter-aspect to accommodate the attention. This is not good. Okay. Relationship here, like the cut 1, cut 2, cut 3. Okay, you see from this. And as for like the square, tapering, ovoid. Okay, palatal form here is the palatal. It is maxilla, you see the palatal form. Like the class 1, it looks like the soft palate is almost horizontal, curving gently downward. This is like the class 2 is like the 45 degree from the hard palate. And class T, it turned down sharply to the hard palate. So we have the 3 types of the palatal toe form. Okay, people surgery, what does it mean that okay, you have to do another kind of the treatment before you start to do the prosthetics phase. Okay, you have to check for them. There are like the fatty tissue or not, hyperplastic tissue increase this or not. Do you know this word or not? If you don't know, okay, next you will know. If this is come from, I will show the picture later. Okay. How about the larger cut in the region of the tuberosity and anterior discoloris? Okay, auto excessive undercut prominent. Okay, we can apply. We need to correct it or not. We have to correct it or not. Okay, this spine English. Okay, as a big pain. If there are a spine, we can do auroplasty. You know the auroplasty or not yet, right? Auroplasty is related. The alveolar bone, you smooth it, cut it, or auroplasty. Okay, this is what you will learn from surgery part 2. Okay. Pendulous maxillary tuberosity to correct is something interesting. Sometimes the tuberosity is maybe like it grows down. If it went to the space for set up a teeth, then we need to correct. It's called like we do the pre-prosthetic phase. Okay, this one looks like adequate attachment with subjects without undue muscular impingement to normal function in all regions. If it look like it, it's okay, no problem. But if you see some attachment here, it's usually anterior labial, labial, high mentalis muscle attachment here. Okay, this one looks like adequate attachment with subjects without undue muscular impingement to normal function in all regions. If it look like it, it's okay, no problem. But if you see some attachment here, usually anterior labial, labial, high mentalis muscle attachment here. Okay, this one looks like adequate attachment This is the position of mentalist. If it's too high, it's maybe attack at the rib, the top of the rib. We need to do like a frenectomy. If it is physiological like this, okay, you see here, it happens from the inflammatory fiber tissue hyperplasia. These are hyperplasia of the fiber tissue, connective tissue, ill-fitting nature, because it comes from the ill-fitting nature. Patient where the ill-fitting is not good. That is why it made the tissue look like this. It has the hyperplasia inflammatory. So we need to correct this one first because we start to do the new denture. Even like the denture-induced stomatitis, you see here there are a lot of the like the stomatitis. This maybe come from the ill-fitting denture. That is why we need to treat the tissue first until it's normal. After that, we start to do the final. Sometimes it have the candida albicans that form called the dental stomatitis. Okay. Bony prominence exotosis. Look like if there are a lot of bone extend like this, there are some correct form like this. Okay. Big torus, exotosis here, and thorax mandibular here. Okay, we need to thoracotomy and cut the thorax. Okay. Severe alveolar bone resorption, some patients, okay, a lot of the bone resorption, the problem with dental supporting tissue alveoli is very flat. This case is very hard for the undergrad student to do that. Let's refer to the postgraduate student. Okay, but you have, if you would like to know how can we do it, you can go to the residency clinic for the prosthodontics, learn how to do that. Or even you, maybe some student get this, something like that. The instructor, the professor will help you how to do that too, no problem. Okay. Problem of this is like the dental supporting are limited. Okay, surgical treatments such as the visuroplasty or recommendation can be done. You know this one, right? Visuroplasty is okay. You need to make more surplus here. You do the visuroplasty, or even do recommendation. Even use like the artificial bone or relocate to do that too. Okay, that is another card. Okay, PDI. If you see from the chart, you will see this one PDI, like the prosthodontic damage intake PDI. For the classical, for the completely intellectual patient, summary like the class 1 ideal, minimally compromised, class 2 moderately compromised, class 3 sustainably compromised, class 4 is like severely compromised. That's the category like the bone height, maxillomandibular relationship, axillary morphologies, and muscle attachment. These are all kind of criteria. Let's say like the class 1, the classification level describes the most patients be successfully treated by conventional processes. Okay, this is a class 1. Okay, you see, there's a bone height of 21 millimeter. Get the measurement from this. Like the class 1 relationship between the maxillomandibular. Laser morphology that are resist horizontal and vertical movement of the denture is like the ideal normal. Look like this. You see the very thick and okay. It look normal. For the class 2, okay, like the continuation of the physical degradation of the denture supporting structure, it means there are some more resorption, something like that. If you see that is okay, more complex when compared with the class 1. For the class 3, need for the surgical revision. For the class 3, it's military. Supporting structure around for the, it need to do the surgical revision for adequate postoperative function. Okay, addition factor now play a significant role. Like this, let's say it high, 11 to 15 millimeter ratio at the least vertical height of the mandible. The relationship may be class 1, class 2, class 3. And resonance morphology has minimum difference to resist horizontal and vertical movement of the region base. And location of the muscle attachment with moderate influence of the region base based on safety and retention. Then is the problem of the stability of the denture. That's why for the class C, have more limited from the structure. Okay. This is the like the class 3. For the class 4, the more debilitated intravenous condition. Surgical reconstruction is almost always indicated, but cannot always be accomplished due to the patient health, design, paternity, and financial consideration. We got a lot of other process to do before start to do the prosthesis phase. Okay. When surgical revision is not select, post-orthodontic technique and the precision nature must be used in order to achieve adequate treatment outcome. For this case, maybe the patient have limited structure that we can provide for the good retention support and stability. Another tip for to handle for this case, okay. If they cannot do the surgical phase, look at this. We do another kind, the technique of the impression too. You will learn about how many techniques for impression. After treatment plan, we determine for the operating time, laboratory time, and for the fees. Okay, that is all the thing that's for the patient clinical examination and get out to get prognosis. Okay, any question? Too much for this today? You know how many class 1, class 2, class 3, what it is? Okay, don't worry, step by step, and you learn. You will use this one when you go to the clinic, 5 years. Okay, 5 years. And this knowledge, you will have the license part 2, original license part 3. Okay, but don't worry, for the clinical subject, you learn step by step. You learn for the 3rd year,